what looks like lymphadenopathy, the swollen. Lyme disease is reversible at any stage. It's not an infection problem, it's a systems hijacking problem. Here's the issue. Borrelia burgdorferi is designed to hide from your immune system and systematically dismantle biology's defenses, turning them against you. The bacteria crosses the blood-brain barrier to the CNS, central nervous system, and it's a place where your immune system rarely patrols that effectively. And then it embeds itself into connective tissue, biofilm, and intracellular spaces where antibiotic penetration is nearly impossible. This is why you can't out-antibiotic Lyme disease, and biology's initial response, the inflammation meant to save you, becomes what destroys you. That's the real Lyme disease. The bacteria itself represents only about 5% of the pathology of chronic Lyme disease. The other 95% is immune system chaos. Think about it this way. Maybe you can kill the bacteria with antibiotics, it usually fails, but the disease is not the bacteria. It's what the bacteria did to your biology. Here's the tragedy. Early Lyme disease is treatable. The first couple of weeks with antibiotics can actually work, but because testing misses early diagnosis, patients never receive early treatment. By the time they're diagnosed, years have gone by. The bacteria has embedded itself in your biology. Now, antibiotics fail. The patient is told they don't have Lyme disease. They have post-Lyme disease syndrome, which actually isn't a diagnosis. It's a confession of an imbecile doctor who doesn't understand what's happening. And here's the standard of care I see personally as a doctor. A Lyme patient walks into a neurologist complaining of brain fog, usually. The neurologist orders MRI and EEG and all come back normal. Why? Because the neurologist is looking for neurological diagnosis, not a systemic illness manifesting neurologically. That same patient now goes to a rheumatologist. Your joint pain is fibromyalgia. Take an SSRI. Then the gastroenterologist. You have IBS. Take an antispasmodic. Then the cardiologist. Your palpitations or anxiety. Take a beta blocker. Here's where it gets dark, by the way. Borrelia has an affinity for nervous tissue, like a damn GPS for your brain and spinal cord. Lyme neuroborelioza in patients shows CSF pleocytosis, white blood cell elevation with oligoclonal bands. These are patterns that indicate chronic immune activation in the brain. But here's what kills me. Most doctors don't test CSF. They test blood. But blood inflammation doesn't tell you about brain inflammation. The consequence, you get an Alzheimer's or dementia diagnosis. You develop Lyme-induced thyroiditis. You get what looks like lymphadenopathy, the swollen lymph nodes, but it's really immune system congestion. Borrelia also has an affinity for endothelial cells and triggers myocarditis. Lyme arthritis shows up almost all the time. Borrelia produces antigens that cross-react with joint cartilage proteins. You get what looks like rheumatoid arthritis, but the trigger is bacterial. Look, 2018 Frontiers in Medicine documented Lyme patients who were specifically told they would never recover who fully recovered. And yeah, I've done it thousands of times. Comment Lyme for all the research. I've got to go. Never miss.